Good morning. For the record, Chuck Henry, Director of Sarasota County Health and Human Services. This is our COVID update for this week. I'll start right out with the numbers as usual. Cumulative cases, we're up about 1,000 from last time I was before you 2 weeks ago, so at 32,567. Hospitalizations is up 20 from 2 weeks ago, so that's beginning to slow down. Deaths is up 4 from last time. We're also beginning to see a slowdown there, which is really good. Deaths linked to long-term care facilities is unchanged from last time, so that's even better news. And our percent positivity is down to 4.94%. That's the 14-day average. That's down just over a full percentage from when I was here 2 weeks ago. And we're continuing to see that trend downward, which is what we expected as we move away from our, what I call the prolonged spring break season here in West Florida. Our case rates are down 5 from last time. I expect those to follow down as well. They'll just lag a little bit behind the percent positivity. The big change for this week is hospitalizations. We're at 46 as of yesterday in our 4 acute care hospitals, 46 COVID-19 cases. That's down from down 28 because we were at about 75 2 weeks ago. So big change there, welcome change. Our ICU numbers remain about the same. In fact, they're up 2 from last time, from 13 to 15, but they've been hovering in the low teens there, and so that continues to be good news. On the vaccine side, we're now almost to that 240,000 mark. If you take my desire to get to 300,000 people vaccinated by July 4th, we're about 60,000 away from that number. That's going to be a tough 60,000 because the numbers are not moving through our mall site like they were. You know, a month ago we were doing several thousand new vaccines every day, plus several thousand second doses. This week we're wrapping up the end of our almost 2,000 second doses a day, and our walk-in site that's been open for anyone that needs a vaccine at Sarasota Square Mall Monday through Saturday is averaging probably just over 200 a day. Some days as high as 400. Our lowest day was 170. So people are still coming in and getting vaccinated, but it's moving at a much slower pace. Now that's just our efforts at the mall. There's lots of efforts from our community through the drugstores, through grocery stores, and then a number of pop-ups that either we are conducting or that we're trying to encourage or assist other organizations to conduct, as well as closed pods done by some of our larger employers that we're ensuring they have vaccine to do that. So there are more than 200 vaccines happening every day. That's just what's happening at our mall site, and we'll continue to monitor that as we move forward. You can see that.
Hold on, Chuck. Commissioner Dieter.
Well, you're probably getting to it, but this is a good point in your presentation, talking about 200 a day at Sarasota Square Mall. I saw on the news that you're going to be holding something in Venice at Jacaranda Library, correct? Like Thursday, I think?
So there are pop-up events happening at many places. That one is not a specific health department one. It's probably working either with Venice Regional or one of the other community partners that's helping us do pop-ups, but I don't have the specifics on that one.
Well, in order to get more people vaccinated, I think the appeal is if they know in advance where there's going to be a location, what the hours are, and that they don't need an appointment. So the no appointment is really very important, so they know if they're going down Jacaranda Boulevard, they can just stop at the library, get a shot, be back in their car, probably 15 minutes at the rate we're going. So I'm surprised that you don't know that, and I hadn't heard about Venice Regional doing anything. So being from South County, I mean, Commissioner Cutzinger and I would join me in wanting to know where are the quick places that people in South County can go to where there's no waiting other than the mall.
So I do have a slide towards the end that talks about efforts. And I want to be clear, I don't know that Venice Regional is responsible for that one. I just am not aware of that one, but that's indicative of where we're at currently in our vaccine strategies. Vaccines are moving directly from the federal level and the state level to providers, and providers are setting up events all around our community. We try to encourage them to do that. If they need assistance from us, we provide it, but I don't have an exhaustive list of where those providers are doing that. We do have an event scheduled in that we just got the approval for yesterday that I'll talk about when I get to that slide down in Northport.
Okay, and Jonathan, I'd like a hard copy of this slide, because when I tell people these numbers, I have had quite a few say they don't believe the numbers, and I want to make sure I'm giving them the exact numbers. Go ahead, Chuck, keep going.
And these numbers are actually yesterday's numbers because they've been confirmed.
Yeah, perfect.
So they continue to get better each day, and we're pleased about that. You notice on the first dose vaccine that number gets lower and lower, and so that number represents those in our community that have had only their first dose and are waiting for second doses. We want that number to get smaller. We want the series completed number to continue to grow. Completing that series is very important, and it's really important, and I'll say it here and again later, that you're considered fully vaccinated when you've reached 14 days beyond the completion of your series. So if you have a 2-shot series, which is most of our vaccines, it's 14 days after that second dose that you're considered fully vaccinated. The Johnson & Johnson is the 1-dose vaccine that's now back authorized and available. So if you get the Johnson & Johnson vaccine, then 14 days after that first dose, you'll be considered fully vaccinated. This is the figure that Jonathan mentioned earlier. I've added it to this slide, the percent of population 16 and above, which represents everybody right now eligible for vaccines in our community. We're at 61% overall for our population, which is a pretty high number. I think we're at third highest in the state, somewhere in there. And that's really a reflection of our older population. As you recall, we struggled early on to meet the demand for those 65 and above and 60 and above, because 37% of our population is over 65. You know, on this end, as we move forward, a larger percentage of our overall population out of everybody eligible has now been vaccinated, especially those older, more vulnerable individuals. But it's important that we continue to reach out to our younger populations, and so we're trying to do events and pop-ups for that, and I'll be discussing some of those opportunities here in a minute. If we look at our over 50, we're at 77%, and over 65, we're now at 87% of our community vaccinated. So those are really solid numbers, and really speak to our community doing what they need to do and taking care of themselves. As always, I talk about the variant data. We're now at 10,332, so that's up a little over 4,000 from when I was here 2 weeks ago, and we can expect that number to continue as we track these variants. Hospitalizations are up 71, deaths are up 21 from last time. We continue to see a variety of variants, although here in Sarasota County, our number is at 90. That's up about 35 from 2 weeks ago. Again, as we identify these variants, we send samples up, and we're looking to see if the variants are causing more rapid illness in our community, if the variants are able to infect people that have been vaccinated or have disease-acquired immunity. So those are the things that we'd be most concerned about, and so far the science hasn't shown that we're seeing a lot of that. There have been small numbers of what we call breakthrough cases occurring across the state. And so we continue to monitor that closely and work with CDC on that. But by and large, the vaccines have proven to be very effective, even against the variant strains that have come into our community. In Sarasota County, we're seeing predominantly the UK strain. That accounts for, I think, all but 12 of our variant cases, and those 12 are all California variants. So vaccine distribution efforts in Sarasota County, we talked about that a little bit. We're still doing first and second doses at Sarasota Square Mall, and we plan to continue to run that operation until interest in vaccines drops off to the point that it's not worth doing. But that is a solid place that everyone knows it's there. We're running clinics Monday through Saturday there. It's walk-in, no appointments. We are using the Moderna vaccine but it's readily available with very little wait time for anybody that would like a vaccine. Beginning next Monday, actually probably beginning Saturday, we're closing down one of the 2 spaces at the mall. As you know, we've been operating 2 different sites, one for second dose, one for first dose, because of the volume of second dose still remaining. As that wanes off the end of this week, we'll be combining into 1 space to be more efficient, but we still expect there not to be much of a wait at all as we handle both first and second doses in the same clinic space moving forward. We continue efforts to reach out to our minority populations, trying to figure out ways to get vaccines to them, to make it easy for people to make the choice to get vaccinated, because that's what we really want in the end, to increase the number of individuals vaccinated in our community, because that keeps our community safer. We've reached out to large employers, some of which are doing their own closed pods and vaccinating their employees, some of which have worked with us to set up pods to do vaccines for their employers. We've worked with colleges, our churches, many medical providers that are either getting vaccines directly from the state or if it's smaller amounts from us, and we're trying to accommodate anyone that has the ability to give vaccines and people interested in getting vaccines. Just yesterday, we got approval to run our 3rd Pfizer vaccine clinic, and I mentioned Pfizer specifically here because it's the only vaccine currently authorized for 16 to 17-year-olds. This clinic will be held in South County at the George Mullen Activity Center in Northport. We're doing that in partnership with the City of Northport and the State Region 6 Incident Management Team. Excuse me. So we're very excited about this opportunity to be the 3rd Saturday in a row that we've been able to offer vaccines with the Pfizer product open to 16 to 17-year-olds. So that also will be a walk-up, no appointments needed. It's not just restricted to 16 to 17-year-olds. If there's others out there that want Pfizer vaccines, they may also go to the event and receive vaccines. So we encourage people to do that, and there'll be more news about that as we move forward. When I look at key messages, again, at risk of sounding like a broken record, we continue to encourage everyone to get vaccinated as soon as they can. If you follow the news, vaccines have been very effective, as I said earlier, and vaccines are really the way our community is going to move forward and open back up. So the more people that get vaccinated, the more stable our community will be in terms of the COVID disease. We continue to encourage social distancing and wearing of masks in public spaces until you're fully vaccinated. And again, I remind everyone that fully vaccinated means 2 weeks after you complete your series. So that's a really important nuance. And we also encourage people to continue to use caution, even after they're fully vaccinated, because the transmission levels currently in our community are considered high by CDC standards. I apologize, I have a tickle in my throat. CDC classifies transmission as low, moderate, substantial, or high. We're on the edge of high. I expect by next week, because their data lags a week or 2 behind real time, that we'll be down in substantial and moving rapidly towards moderate. Our percent positivity is already in the moderate level, but our daily caseload is still up in the high level, and they put the label on based on whichever marker is higher. But that's an important factor as you think about how you're going to protect yourself and others in our community, understanding where our transmission levels are at. Of course, continue to wash hands vigorously and often, and staying home when we're sick is probably the most important thing we can do. That ends my presentation this morning. Unless there are specific questions for me, I'd be happy to try to answer.
I want to thank you. This has been a long run for you, and for the first time in all these months, there are no questions for you. So thank you very much, Chuck. Thank you.